talk on ileal disorders, including ileal impactions and ileal hypertrophy. Ileal impactions are a fairly uncommon cause of colic in this area. They're more common in the southeast U.S. And impactions develop in the ileum, usually identified at surgery. So in this surgery, the surgeon is holding the ileum in the right hand and the cecum in the left hand. The ileum is identified by the antimesenteric band and its connection to the cecum. So do you remember which band of the cecum continues as the ileal antimesenteric band? This is more common in Arabs and mares, generally seen in the southeast U.S., and seen in horses that are eating a lower quality Bermuda grass hay. Generally, the hay quality deteriorates as the summer goes on, so we see more cases of this in the fall and early winter months. It is also associated with tapeworm infestations. Clinical signs are generally worsening colic signs over time, with developing small intestinal distension, and horses get reflux late on in the course of the disease. So questions for you are, why would tapeworms be related to an ileal problem, and why would the reflux be a late sign in this disorder? Diagnosis is usually based on rectal palpation. If you catch the disorder early enough, you may actually feel the impaction in the ileum. Most times when I've had one of these, I just felt small intestinal distension all over as they were presented to me later on. Transrectal ultrasound may also let you see the impaction if you can get past gas-filled lips of small intestine. Most commonly, these are diagnosed at surgery. Complications can include gastric rupture from the fluid buildup and hypovolemic shock, similarly from the fluid sequestered into the small intestine and stomach. Prognosis is good with a very low reimpaction rate. Treatment involves referral. It's hard to differentiate this small intestinal lesion from other small intestinal disorders, either obstructive such as a tumor or strangulating such as a lipoma. It's very hard to manage refluxing horses in the field as they need IV fluids and parenteral nutrition, but please pass a nasogastric tube before sending the horse to the referral center to make sure the stomach doesn't rupture. If the impaction can be diagnosed without surgery, horses can be treated with IV fluids, pain relief, and the mineral oil once they stop refluxing. Generally, they're treated at surgery with massage of the area and saline infusion to break up the impaction. To prevent, horses should avoid eating late-stage Bermuda grass hay and be dewormed for tapeworms. I want you to start thinking about which products are effective for tapeworms and which ones are not. Ileal hypertrophy is another ileal disorder that can lead to ileal impactions. We don't know the cause, but it leads to muscular hypertrophy of the ileal wall. And due to the narrowing, these horses get recurrent impactions. This is more common in older horses and more common in horses with tapeworms. Clinical signs include recurrent colic, partial anorexia, and weight loss. They impact, they break down the impaction, impact again, resolve the impaction, and impact again. Diagnosis is generally at surgery. Complications can include ileal impactions or outpouchings or diverticula of the ileal wall, and these can actually rupture too. Prognosis is good if treated appropriately. Treatment involves referring and surgical bypass. The jejunum is connected directly to the cecum instead of just coming from the jejunum through the ileum and into the cecum. Horses should be dewormed for tapeworms, and if you've remembered, hopefully, praziquantel and double-dose Stringent are effective. Tapeworms are resistant to ivermectin and to most of the older drugs such as fenbendazole. These are some other miscellaneous ileal issues that may be seen at surgery. Mesodiverticular bands are congenital lesions that are often incidental findings. Meckel's diverticulum is an outpouching of the ileum. These can become impacted and can actually rupture. And then hemamelasma ilii is a colorful finding. If found at surgery, doesn't cause problems and is probably related to parasite migration.